Good morning, Mike's Diabetes World. Well, afternoon, night, whenever you're watching this. It's Mike here, and today I want to talk about wounds and wound types. You know, what and how do we take care of ourselves? How do we make sure we don't have them? Well, we'll have to sit back, relax, take your coffee, your tea, your hot chocolate, and we'll be right back. So, why is diabetes and wound care so important? And why does it have to happen? Well, medical science has pretty well told us that it happens because of what were they? Diabetic neuropathy and diabetic arterial disease. And both can make the blood vessels smaller than normal. And when you get into the smaller blood vessels like the capillaries, your blood sugar will inhibit this, but it'll make everything smaller, and you won't get the blood and the nutrition and the oxygen you need to fight off the disease. This can happen to a new diabetic, it can happen to an old diabetic. You're not protected. The only way you're really going to be protected is if you're every day you are watching your blood sugars and trying to keep them as close to normal. Now, some people, it's medically, you're medically unable to. People like me who are a brittle diabetic. So anytime I get anywhere that is looking angry, or if I'm showing any other symptoms, which we'll get on in a moment, I go see my doctor. Doesn't matter if it's my GP, my endocrinologist, whoever I can get in ASAP, and they will take a look at my wound and decide what the next course of action would be. But it's important that you go out and you find a medical doctor. Don't just try, well, grandma's medical compound was great. Well, discuss it over with your doctor first. Don't just go off treating everything, because you could end up in worse shape. You could lose a limb. It could even go as far as where you could lose your life. Serious stuff. There are two types of wounds that we have to be careful of. They are internal, which means you can be punched, you can be kicked, and any wounds that come out of that. Next type is external, so you cut yourself, you fall, you trip. Anything that breaks the skin there is external. So things like skin ulcers, which you need to get treated right away. Any kind of wound, you should really go see your doctor. And I'm not pulling, oh well, only your doctor knows the true answers. But they are able to get medical care for you. So, you get an injury, a wound, get it taken care of. Go to emergency, go to a walk-in clinic, see your doctor, but see someone. Don't just leave it to chance. Now, a problem with any wound in a diabetic is they can go unnoticed because, like on your feet, you don't see them. Sorry. So they sit there and they fester, and you're not going to go until the pain is so severe because you want to show that you're a big guy.
I always think about that with things like
But that's
profiling.
where an awful lot of people lose their limbs. So don't fall into that category. Take care of yourself. There are two types of wounds that we have to be careful of. They are internal, which means you can be punched, you can be kicked, and any wounds that come out of that. Next type is external, so you cut yourself, you fall, you trip. Anything that breaks the skin there is external. So things like skin ulcers, which you need to get treated right away. Any kind of wound, you should really go see your doctor. And I'm not pulling, oh well, only your doctor knows the true answers. But they are able to get medical care for you. So, you get an injury, a wound, get it taken care of. Go to emergency, go to a walk-in clinic, see your doctor, but see someone. Don't just leave it to chance. Now, a problem with any wound in a diabetic is they can go unnoticed because, like on your feet, you don't see them. Sorry. So they sit there and they fester, and you're not going to go until the pain is so severe because you want to show that you're a big guy.
I always think about that with things like
But that's
profiling.
where an awful lot of people lose their limbs. So don't fall into that category. Take care of yourself. Okay, what are the symptoms? Well, the symptoms are pretty simplistic. It's just like any infected. You can tell when a wound's becoming infected because, first of all, you could have a fever. Now, it could be a relatively intense fever, but that will move it along. Like, as you go on, you'll get a higher fever. If you do have a fever, if you get into the high fevers, go to emergency. I can't stress it enough that I know even myself will sometimes say, oh well, they're busy, I don't want to interrupt them. But it's your limb. get onto antibiotics. If you can't go see your own doctor, go to emergency. But, a lot of times, oh well, I just have a mild fever. But no one really goes and checks. They all kind of sit there and, oh, yeah. And then what ends up happening is we lose a limb. Next, redness around the area. Now, as some of you have heard in the blog, I took a fall on Sunday. I have a head where I broke my skin, my knees, and I'm watching them. I have an injury to the toe, which my doctor looked at yesterday and said, it's not infected, but it is looking a little angry. Now, looking angry means that it's gone red, and it could blow up into a major infection. Next, if you're tired, the site will be warm, and the more of the infection you have, the more the site will get warmer. So you're looking A for red, B for that it's getting hot. Don't try to force it along, or don't try to ignore it, because things like that will continue to fester, and then you're going to go to emergency, and a lot of times people just leave it too long and they lose a toe, or they can lose a whole limb, or, as I mentioned before, they could lose their whole life. Well, besides losing your toe, you can lose your whole foot, or even your life. Well, it's I don't know which day it is of recording this, but any sort of wounds should be taken care of right away. Now, so often, people like myself and will sometimes put it off, and I'm going to be a big man about it. I'm not going to need to take things, but you have to be aware. You don't want to be stuck in a chair. Now, I'm not stuck in a chair because of a wound, but it's still not fun to go racing around in a scooter. I would love to go walking, but it's a lost thing if you lose part of your foot. Just the freedom of getting out and going places, that will be gone. And it can be a progressive thing. Now, so often, hi, Mr. Bird, diabetics will not want to bother their doctor, and I won't go to emergency. Well, a lot of home treatments don't work, and people need a wake-up call. If it happens during the day, and it's a small wound, put some antibiotic cream on it, cover it. If it's a major wound, go to emergency. Or, if you can, see your doctor. Get it taken care of. And just because, I have it covered, No, it needs to be changed on a regular basis. So often people will just, for whatever reason, they won't change their dressing. Well, I went to my doctor, he changed it, or they'll miss appointments. Oh, it doesn't fit into my busy lifestyle. It's not only you, but your doctors need to take a lead, but you also need to learn that you have to take responsibility. You don't take responsibility, then you might as well just say, okay, I'm going to lose the leg. And stopping an infection before it starts is the main thing. So, just treatment. Well, I think we alluded to what some of the treatment can be before, but surgery, you want a debridement, you're going to have to use a cart to get around. Now there's these little where you walk and you pretty well put your knee on it and get the foot that you're having the issues with, and you roam around. It's not easy. It's not easy to get around with a chair. But, it keeps you up. Standing up is going to be better than sitting down in your care of your own diabetes. Don't, woe is me. Well, the best treatment is prevention. And you should be doing everything possible to make sure that your blood sugars are within range. Don't go and pass things off. Oh, well, yes, my blood sugar's up today, but I don't want to take another needle. It amazes me how when people get sick, no, we'll call it sick, or have a wound and it gets infected and they've had to lose a toe or a leg, and a lot of times it's woe is me, you've all got to take care of me, I'm just too sick, Well, I know for a fact a lot of times it's not taking care of your diabetes. Now that could be you. That could be a lot of outgoing factors. Oh, you're not taking care of yourself. You'll eat whatever you want and then medicate whenever you want. And why do people get so upset about having diabetes? It's because it takes away from your lifestyle. And I'm gonna have to be old, I'm gonna have to be, I can't have what I like to eat. They don't know what they're talking about. But when they lose a leg, everyone needs to take care of wounds. Diabetics, it's going to happen to you more often because the sugar in your blood. Sugar loves to have the food. Or not sugar, sorry. Bacteria loves to have the food. So, you've got to make sure that you keep it in normal ranges. Not going to have extra, well, you're not going to have to go through debridement, uh, the pain. Your body was used to walking, and if you go gangrene, the only treatment is a loss of a limb. Now, it could be something as simple as a toe. Well, the toe's not simple, but I mean in the range of surgeries up to a leg. And then you're going to be in a chair, a walker, things you have to take care of your blood sugars. Now, some diabetics can't control their blood sugar. But most can. And most people aren't liking what they have to do. And a lot of times, what they have to do is going to be better for their bodies. Rest. If you have a wound, rest. You should be, if any signs of infection, you should be on an antibiotic to give you a fighting chance. And if you're on an antibiotic, you shouldn't be out drinking every night. And you should be doing your best not to miss. If you're put on IV antibiotics because of the wound, show up for the IV antibiotics. Oh, well, it's a pain. Oh. You have to take responsibility. You have to get out, take care of your treatment. It's not, part of the treatment, like I said, is prevention. How many of you actually check the bottom of your feet? Probably no one does it. Get out of the shower, take a look at the bottom of the feet. Use a mirror, put a mirror on your, down on the ground and take a look at your feet. If you notice anything, if you notice a wound, get it taken care of. You don't want to go to emergency, go into a walk-in clinic. Excuse me. I used to think, now I did this when I was high blood sugar. I don't want to go and interrupt. They're all busy. I'll wait a bit. Well, that could be the dying. You don't want to lose it. But what you have to do is, when you see a wound, whatever the wound, get treatment, get it covered, put polysporin on it. If you get it's not a rash, a streak going up your leg, get it taken care of. Don't just assume everything's going to be taken care of. You need to ensure that you do what you have to do. And like I was saying, if you're on antibiotics, you shouldn't be drinking. Oh, gee. Yeah, I can't go 2 weeks without drinking. Well, maybe you have a problem then. If you do everything you're supposed to, and you get a bad infection, and you happen to lose a limb, well, that may be something that, we can work on. But just don't let things go for no reason whatsoever. It's kind of like the old adage about voting. If you vote, you have a right to complain about the government. If you don't vote, you don't have a right to complain. If you've taken the time to do what you need to do, then it's all good. But if you don't have a right to, oh, well, I'm in a chair, yes, I've lost a foot. Oh, you should be eating proper food. You should be taking your medications. I've said that sometimes Nico's on my arm. You can go out and you can party, but not every night. Nico, heel, please. Excuse me. Come here. I'm sorry for this one being so late, but I tried something new. Didn't always work. I tried it with different camera and had to re-record over 2 days, and it started to rain. But in conclusion, try to be a good diabetic, and I've talked about this. There's no such thing as perfection, but you can strive for excellence. Excellence can be a simple thing of taking care of yourself. If you're sick, take a day to rest. If you go to a meeting, maybe put your foot up. If you have a wound, get it treated. Don't sort of, oh well, woe is me. I keep hearing that all the time, that diabetics get sick and they could have done something. Now, doing something that is common sense should be easy. Oh, well, yeah, it's only a little cut. Oh, yeah, I'm not going to worry about it. Well, you keep not worrying about it, and then all of a sudden you have a problem. So get out there, take care of things. Is this it? Now my pump, for example, now is saying hi. I took a correction beforehand, but it's still saying a high predicted. So I've done what I had to do. Watch your blood sugars, eat well, sleep well. And no one will blame you if you go out and you have a party or something else. That you went through a week of work where you had to work odd hours. There's a lot of medical science out there that will help you protect your limbs. However, you have to do the work too. Take care. We'll talk to you tomorrow. Bye now.